proposals that will ensure that every Kenyan is able to have access to health insurance, because health insurance is the basis of us being able to offer universal health care. Please expedite the passage of these bits of legislation that will allow us to ensure that our people are properly catered for, not just during times of pandemic as we are, but always. And that is the purpose, access to quality health care.
And still on matters health CS Mutahi Kagwe urged Kenyans to stick to COVID-19 protocols in order to be safe from the virus. Kagwe say the available vaccines are effective according to emerging evidence. He further noted that the countries that experience high surge of COVID-19 cases is due to emerging variants of concern have had their situation compounded by large social gatherings.
No evidence that the B1617 is causing more severe illness. However, the associated surge in cases has been straining the health system in affected counties. The good news, though, is that emerging evidence shows that the existing vaccines, the AstraZeneca, the Pfizer vaccines, are effective against these variants. Nonetheless, constraints. Countries that are experiencing a surge of COVID-19 cases due to emerging variants of concern have had their situation compounded by large social and public gatherings and a limited availability of COVID-19 vaccines. Fellow Kenyans, in view of these developments, and given that the county government of Kisumu is supposed to host this year's Madaraka Day celebrations,
Kimilili Member of Parliament Didmus Barasa, Nandi Senator Samson Cherargei and Chisumei Member of Parliament Wilson Kogo were in Bungoma Law Court for the mention of their criminal case. Speaking to the press, their lawyer Christopher Mitei say that his client's case is being politicized.
Mention tu kuchukua tarehe ya kusikizwa kwa kesi, tumeongelesha upande wa prosecution kwamba ni vyema watoi kesi kwa maana ni kulingana na kwetu ni kesi ya kisiasa. Wamepatikana barabarani wakisema wanaenda kukose chaos ambaye si kweli. So leo wamechukua tarehe ya kusikizwa kwa kesi ambapo itakuwa tarehe 1 Julai na tutarudi hapa tena Bungoma kusikia hiyo kesi. Asante. Tuko tayari, hao watakuja na evidence yao, tuko tayari kuwauliza waseme kama kweli wangepatikana kwa ground ya Kabujai na hata kungekuwa na hata msongamano, lakini wamesimamisha tu kwa barabara highway, ni kila mtu anapita. Sisi tunaona ilikuwa kesi ya kisiasa, na hata wakati ya Matungu kuna watu walishikwa huko wakiwa na visu na waliwaji, hiyo kesi imefungwa, na hii hata ni rahisi wangekuwa wamefunga kama ile ya Matungu. Hearing upande wa mashtaka wataleta evidence, wataleta witnesses na evidence, tutakuwa tayari kama mawakili kubambana nao kulingana na kisheria.
Moving forward, non-governmental organizations in Busia County accuse the county government of Busia of failing to implement projects over the years. Only 30% of projects have been completed so far, as our very own reporter Faith Jepchirchir reports.
According to the non-governmental organizations in Busia County, the county government of Busia has failed to implement several projects. For the past years they have been in office. It's only 30% that has been completed so far.
Ni hiyo ripoti bado ijatolewa nje for public utilization ili iweze kutuambia kwamba tumefikia asilimia 60, 70 ama 30 kulingana na zile annual development plans against the CIDP yenyewe, bado tuko asilimia chini. So tunaweza patia serikali ya Busia kwamba wametekeleza asilimia 30 kati ya 30 na 40. Na sasa changamoto kubwa hapa ni kwamba hii ndio mwaka wake wa kifedha wa mwisho.
These organizations claim that the Busia County government has been introducing different projects in each financial year that later failed, thus leading to misappropriation of normal money.
Vyema kabisa kama tutakuwa tunapitisha bajeti na tunajikakamua, tunajikaza kwa Hii maneno ya kwamba tunashinda tukisongeza masuala kadhaa ambayo yalikuwa kwa bajeti kutoka kwa bajeti moja hadi bajeti nyingine inasababisha kukuwa na no value for money. Na wanazidi kukuja kwetu ya kwamba tuzidi kupitisha. Bado kuna gap kubwa. Ukiangazia masuala na public participation aswa sana ufanyika Busia, Matayos County. Sasa unapata ya kwamba yule mtu ambaye yuko mbali, yuko Bunyala, yuko Samia, yuko kule Teso North, hawezi pata nafasi ya kufika na kukuwa part of the process.
The chairman of the Association of Social Organizations in Busia County, Thomas Mango, says that the projects that were established in the previous years are still pending. Speaking during a meeting that brought together 20 social and non-governmental organizations in the county, said that a large percentage of projects established by the Busia County are still in limbo.
Kwa mwisho wa 2021-2022 budgets ni kwamba tukilinganisha bajeti ya mwaka huu na zile bajeti zilizopita za miaka 4 iliyopita na tuangalie CIDP, tunapata kwamba Busia County hata haijafikisha 50% of implementation of the County Integrated Development Plan ya 2018-2022.
Utathmini wa hiyo CIDP ilifanywa hapo nyuma.
Wakati tunapoangalia masuala haya na kwamba pesa za wananchi zilitumika kutengeza hiyo CIDP, na pia baada ya kutengeza CIDP ni kwamba masuala mengi ambao yalikuwa yameangaziwa katika CIDP hayajatekelezwa mpaka kwa sasa, basi mwananchi anabaki akijiuliza, je, hizi pesa zote zinazokuja Busia zinaenda wapi?
Reporting for Tandao News at 7, I'm Faith.
Malaria remains to be a major health concern in Kenya. Bungoma County is one of the counties that bears the heavy burden of the disease, and the distribution of mosquito net will be distributed to every household, as our reporter Caroline Mugure reports.
Bungoma County is one of the counties in the country that bears the highest burden of malaria. This is according to County Director of Health in Bungoma, Dr. Johnston Akato, while launching a mass distribution campaign that is aimed at reducing the high rate of malaria infection in the county.
Malaria inakuja, but malaria still remains our #1 disease burden. When we talk about the number of people who come to our health facilities, when we talk about the people whom we admit in our various facility wards,
Akato says children under the age of 5 and pregnant women are among the most affected by the disease, therefore urging Bungoma residents to frequently visit health facilities to get directions from the health workers and help eradicate the disease.
Malaria still comes up #1. When we talk about the under 5s, our biggest burden is malaria, followed by the pneumonias. When we talk about pregnancy, one of the common causes of miscarriages, early deliveries, and even deaths in our setup is malaria. One of the common causes of school absenteeism is malaria. One of the reasons why workers in Western Nyanza region, the malaria endemic counties in this country, workers don't come on duty because they are unwell. The commonest condition they have is malaria. And so, we have no alternative but to look for a way to control malaria.
Technical Officer of Afya Ugavi, James Mwangi, speaking during the launch, said they will distribute the mosquito nets to the entire county of Bungoma, and they are targeting 400,000 households. Mwangi urged those who will receive the nets to use it in a proper way.
1,000 households that are in Bungoma counties across the 10 sub-counties. So it's going to be evolving, and we want to visit each and every household to ensure that at least each and every household is protected. So for me, and on behalf of the team, we have a team of
Dr. Chege added that malaria remains a major health concern in Kenya, besides being the leading cause of morbidity and mortality, and it is listed among the top 10 causes of outpatients visit countrywide.
Saying that the 27 counties are the lake endemic region, coastal endemic region, and also the epidemic prone. Those are the Rift Valley counties where we distribute these nets, among other irrigation counties, that is Turkana, Baringo, and Marsabit, where we have seen a lapse of...
Reporting for Tandao News Desk, my name is Caroline Mugure.
Well, the story gives me a chance to take a short break, but before the break, remember Tandao is still giving you shopping and paying your bills. And in case you're wondering how to go about it, it's very easy. Take your phone, go to M-Pesa and send in 100 Kenyan shillings to pay bill number 4044769. Account number is Tandao.